On a scale of 1 to 10, smoking only on weekends.
I would say 1 out of 10 because even smoking occasionally can cause lung damage and increases your risk of getting lung cancer.
On a scale of 1 to 10, vaping instead of smoking.
That's again, I would rate it 2:10 because vaping has harmful chemicals and heavy metals involved, which can cause acute lung injury.
Okay, so on the same vaping, people go for like a 2% nicotine, 3% nicotine, and 5% nicotine. Can you just explain whether the percentage actually affect the people?
See, it's not just about nicotine. If you're talking about vaping, it's not just about nicotine. You also have to keep in mind that it has various chemicals involved like THC and other heavy metals. These are actually very harmful for the lung. Apart from that, even smoking. Vaping can also cause increased smoke exposure. So smoking itself can be harmful for the lungs, and keep the nicotine aside, but the smoke itself can cause lung damage.
On a scale of 1 to 10, sleeping after 3 a.m. or 4 a.m. every day.
Say 3 out of 10 because it disturbs your body clock and in turn hampers your immunity.
Can you give us the tips for the people who are doing the night shifts?
So the people who are on night shifts, they can plan their day accordingly, like, maintain certain hours of sleep. What we tell them is you maintain a sleep diary so that we know how many hours they are sleeping during the daytime, and at what time do they go to work and what time do they come back, and that's how we can maintain that sufficient amount of sleep, whether they're getting that amount of sleep or not. And also the sleep quality, that is also what something is stressed upon. So that is what we tell them, to maintain a sleep diary so that we can take into account all these things.
So on a scale of 1 to 10, using phone till you go to bed.
Mobile phone usage emits blue light. It can delay sleep, and also it not just reduces your sleep quantity but also impairs your sleep quality. That ultimately hampers your immunity and also makes you more fatigued during the day.
On a scale of 1 to 10, skipping breakfast every day, does it affect lungs?
Skipping breakfast affects your metabolism, which can indirectly affect your lung health. It's not directly related to lung health, but indirectly it does come into account because it affects your metabolism.
On a scale of 1 to 10, drinking coffee every night.
I would say 3 on 10 because coffee after 5 p.m. is not advisable because coffee contains a high amount of caffeine, and again it impairs your sleep quality because the person is wide awake and decreases the sleep quantity as well as quality.
So if you can you just distinguish between the different type of coffees that are available, like a filter coffee versus coffee that you get in Starbucks?
Right, it depends on what was the quantity of caffeine involved. Like you can just go to Google and check Arabica coffee or Americano or espresso. Just see how much amount of coffee they are using, how much amount of milk they are using, and how much amount of water they are using. More the caffeine content, it's not good for your sleep health.
Okay.
If you're using it post 5 p.m.
So on a scale of 1 to 10, using AC while sleeping all night.
See, I think it's fine. 5 or 6 out of 10 maybe. Because using AC is not bad for your lung health, because nowadays ACs are coming with various kind of filters and all sorts of things. And I think now air purifiers are also incorporated in these air conditions. So I would say it's not bad for lung health, I feel. But one thing is make sure you have the outdoor unit of your AC. That's where usually we see in apartments that these pigeons come and sit on it, and your compressor is there outside. So that pigeon droppings are going into your compressor, and that air is coming into your room. That's when it becomes bad.
On a scale of 1 to 10, going gym without warm-up.
See, I think 4 out of 10. That depends on what kind of intense exercise you are doing. If you're doing a mild intensity exercise, then it's fine. But if you're going for a high intensity workout, then warm-up is essential because again, different types of muscle injury and all. It can also, if suppose your chest muscles are involved, it can impair your breathing.
On a scale of 1 to 10, taking cough medicines without a doctor consultation.
See, that is, I think 1 out of 10 because various cough medicines are available in the market. They come with their side effects, so it's always advisable to consult your pulmonologist before taking it.
On a scale of 1 to 10, diagnosing using AI for the lung health.
See, I think that would be 3 out of 10. AI does help you, come to a conclusion, but it also brings with it a lot of anxiety and fear. So that is where a doctor can be, more reassuring.